Okay, we are live, ma'am.
Yes.
So, good evening, everyone. This is Ankana, the assigned moderator from IJCP Group. I welcome all the delegates across the country in today's session. We are fortunate enough to get supported by the doctors. Thank you, all the doctors, for taking out time to join us today. Today, we are going to have a very important topic to cover, which is really crucial in our day to day life. That is keto gone wrong, a case of nutritional ketosis versus ketoacidosis. Hence, without any further delay, I'm taking this opportunity to welcome today's master doctor, none other than our very well known dietitian Smita Shah, ma'am. Ma'am is the dietitian and obesity consultant at Dia Care Diabetes and Hormone Clinic, Ahmedabad. Now, I would like to hand over the session to you, ma'am. Kindly proceed with your discussion. Over to you.
Yeah. Okay. Thank you very much, Ankana. And thank you very much for giving me a chance for giving this opportunity to deliver my talk. And thank you, my talk, for giving me an opportunity. Today, my topic is the keto gone wrong. Ketosis versus ketoacidosis. Doctors originally developed the diet to treat the children with epilepsy. For this classic ketogenic diet involves eating 3 to 4 grams of the fat for every 1 gram of the carbohydrates and protein, with 90% of the all calories come from the fat. So this diet was originally developed for the epilepsy for the children, and now it becomes very popular for the weight loss, the keto diet. So uh, this is what is the keto diet. This So what is the keto diet? So keto diet is 70 to 80% from the fat, 20 to 25% from the protein, and the carbohydrates only 5 to 10%. The ketogenic diet is a high-fat, low-carbohydrate eating plan designed to shift the body's metabolism into a state of ketosis, where it burns fat for the fuel instead of the carbohydrates. And this diet aims to promote the weight loss and improve the overall health by lowering the insulin level and stabilizing blood glucose. It may also boost the energy, enhance the mental clarity, and reduce the hunger cravings. So, what happens in ketosis? You can see the liver breaks down the fat. Oh, shit. Yeah. Liver break down the breast fat into the liver, and what's happened? The metabolic shift can lead to the increase of the oxidation, promote a more stable energy level throughout the day, reducing the typical energy crisis associated with the carbohydrate consumptions, and the reduction in the carbohydrate intake can lead to the stabilized blood sugar level, which is particularly beneficial for those managing the diabetes or insulin resistance. The diet emphasis on whole and unprocessed food can lead to better nutrient intake, supporting overall well-being and validity. A mix of strength training, cardio, and practices like yoga and medications improve muscle tone, boost the cardiovascular health, and support mental and well-being for a balanced lifestyle, typically achieved with less than 50 grams of the carbohydrates. So how does ketosis work? You can see the traditional diet with high carbohydrate. Its glucose level rise when you're eating the carbohydrates. Then pancreas secrete the insulins, and insulin settles glucose into cell and then create the energy. The energy now creates from the carbohydrates. And what in the keto diet? Keto diet, higher fat, its glucose level fall, and lipase release stored triglycerides, and fatty acids travel in the liver, and the liver produce the ketones as a form of the energy. So this is the difference between the carbohydrate intake and the fat intake. The potassium benefit for the individual with the diabetes. So first is the better glucose control, the lower the insulin level and improve the insulin sensitivity. reduce the spikes and dips in the glucose level, and especially the keto diet was for weight loss. And ketogenic diet can promote fat loss, beneficial for the type 2 diabetes, lower the HbA1c level. Ketogenic diet can lower average blood sugar level over the time, and diet may help stabilize energy level throughout the day, reducing the spikes and crashes often associated with the high carb diet. And ketone produced during the ketosis have been shown to have anti-inflammatory properties, which may have mitigate the diabetes related inflammations. And it's important to approach the ketogenic diet with caution, and not everyone any may experience this benefit, and individual responses can vary significantly. Moreover, consulting with a professional qualified keto dietitians, making a drastic dietary changes is advisable to ensure the approach aligns with the personal health and the goal. So now there are so many research and systematic review and the meta-analysis to recent the studies that the glycemic control and the weight management. The ketogenic diet shows no significant improvement in control of the body weight for the type 2 diabetes patient for 2 years, but did enhance lipid profiles. And the second review that a very low calorie ketogenic diet may improve the blood glucose, HbA1c, and body weight, making it promising for type 2 and obesity management. In type 1 diabetic patient, the ketogenic diet reduces the blood glucose and insulin needs, but carries a higher risk of ketoacidosis. And the controversies and the clinical practice, the long-term safety and the ketogenic diet for diabetes remains uncertain due to inconsistent evidence and the lack of standardization. Current guidelines favor whole foods and the personalized dietary recommendation over specific nutrients, and clinical trials show mixed result of emphasizing the need of the long-term studies. Hmm. Video. Full screen. वीडियो वीडियो फुल स्क्रीन से अपन पति जैसे पति विजन देखा हाँ विजन ओके फाइन कर दो sorry for my slide is not moving. Now, what are the risks and challenges for the keto diet? When you switch to a keto diet, you may experience the short-term side effects while your body adapts to using the ketone and is primary energy source. The side effects known as the keto flu maybe include that nausea, sometimes vomiting, headache, fatigue, dizziness, insomnia, constipation, and also it may be increased the LDL cholesterol. So the guidelines for the diabetic patients who are the diabetic and who want to do the keto diet. So there are some guidelines for the patient that monitor blood sugar closely, use glucose monitors, frequent glucose and ketone monitoring, consult with the healthcare provider, specially qualified keto dietitians. Important to adjust the insulin and the medications. Stay hydrated to avoid the dehydration and maintain the electrolyte balance. and balance the protein and the fat with the focus on the healthy fats and adequate protein intake. The fat intake should be healthy. That is the most important, is come from the fat and vegetable oil and that kind of the fat rather than butter and cheese. And stay mindful for fats and track your macros, keep a long carbohydrate intake. So these are the guidelines for the patients who wants to do the keto diet. Now, who should avoid the ketogenic diet? The individuals with the type 1 diabetes is the risk of the ketoacidosis, the pregnant and the breastfeeding women, and nutritional needs are higher, and people with the kidney and the liver issues can strain this organ. So these are not allowed for the keto diet. Now, I will discuss the two cases of the dieters ketosis, means who are on the diet and they develop the ketosis, and the second is the diabetic ketoacidosis. The first case is the Kavita. She is a 30 years old, healthy on keto diet and doing the intermittent fasting. Active, she is no medicine. We will discuss rather. And case number two, this is for the Rohan, 24 years, is a type 1 person and is miss insulin, presents with the vomiting, drowsiness, and fruity breath. So we will discuss these two cases, and both are in ketosis, but only one is in crisis. So who is in the crisis? We will discuss further. So the case study, nutritional ketosis, is the physiological ketosis in non-diabetic adult. So the patient details. The patient name is Kavita Jaiswal. She is 38 years old. She is female. Her occupation is, she is IT professional and she has no diabetes or no chronic illness, but she is overweight. Her BMI is 29 and started ketogenic diet 3 weeks ago. So presenting complaints was the routine health checkup, but she feels the mild fatigue and headache since last 1 week, and fruity breath odor, and occasional the muscle cramp, and 3.5 kg weight loss in the 3 weeks. So then the physical examination, she was in mild dehydration. Her BP was 114/72 mmHg. Her heart rate was 82 per minute. Respiratory rate was 14 per minute. Temperature was 36.8 centigrade. And no confusion or no tachypnea and no signs of the metabolic distress. Her fasting glucose was 88 milli per deciliter. Her serum ketones were 1.5 millimole per liter. Her pH level was 7.5. Bicarbonate was 24 mg equator per liter. Sodium was 137 milli equator per liter and potassium was 4.3 milli equators per liter. Urine ketones were positive and normal acid base and electrolyte status. So this was as laboratory investigations and the assessment and the management, diagnosis, nutritional ketosis, and how to manage. Reassured no pathology and advised sodium and magnesium in that. We used to give her the limbu pani with salt. Advise sodium and magnesium intake, encourage for the hydration, and educate on the safe continuation and exit strategy on the keto diet. How to continue it, how to hydrate it, and how to uh, uh, take some fluids. So we educate her and explain her about the keto diet. So the clinical courses and the outcome, they resolve fatigue by 3 weeks, improve the energy and weight loss continue, no acidosis or complications, remains the stable on the diet and continues regular follow-up. So she was on the ketosis due to diet-related ketosis. So the discussion and the takeaway message for that nutritional ketosis is a physiological and safe. Mild ketones 0.5 to 3 per liter, millimole per liter, and normal pH, glucose, and electrolytes, distinct from decay by labs and symptoms, and important from clinicians to recognize and the reassure and monitor hydration and the minerals. So for the nutritional ketosis, we have to keep in the mind for this all the parameters. Now the case number 2 study is the 69-year woman that I had this case study I had taken from published case study on the April 2020 by the Christopher Spoke and the Samer Malabe and the Department of the Medical Educations of about uh, uh, northern western in the Minneapolis. I had taken this study. So this study refers that a 69-year-old woman present with the fatigue, fogginess, and the sugar craving. She had been following a strict ketogenic diet for almost a year and had consumed the alcohol prior to presentations. Now her clinical presentation, the parameters was her blood sugar was 39 to 64 milli per deciliter. And in the you can see in the ketoacidosis, usually the blood sugar is greater than 250 per milli per deciliter. Her pH level was normal, no metabolic acidosis. And in the ketoacidosis, the pH level is going down less than 7.3. Her hydroxybutyrate was 5.5 at time of the admission, and in the ketoacidosis is the greater than 30 to 50 milli per deciliter. Her insulin was 12.9 and declined during fasting 2.8 and is low or absent in the decay. Her C-peptide was 2.2 and in the decay position low or the undetectable. Her proinsulin was 3.1, is low or the variant. Ketones was positive, but she was in the ketosis. Her serum cortisol was 21.8 and in the ketosis is often elevated. Her symptoms was she was fatigue, fogginess, tremors, and no acidosis sign. And in the ketoacidosis, the vomiting, abdominal pain, fruity breath, small respiration is very common. And precipitating factor was prolonged keto diet less alcohol. And in ketoacidosis, insulin deficiency and starvation. So the treatment approach is the glucose correction, increase the carbohydrate intake 50 to 150 grams per day. And for the ketoacidosis, IV fluid, insulin, and electron correction. So this is the clinical presentations and diagnosis and the management. Diagnosis, the starvation, ketosis with the hypoglycemia, and management, they do, she was given dextrose infusion, increase the carbohydrate intake 50 to 150 grams per day, and outcome was discharge with the dietary counseling, no evidence of the diabetic ketoacidosis. So normal ketosis versus ketoacidosis. The key difference is the normal ketosis control, mild ketosis, and no acidosis. And ketoacidosis is the severe ketonemia, acidosis, and often life-threatening. This case illustrates that overlap and risk of the alcohol consumption. So now the case of the ketoacidosis and this study I had taken from ketogenic diet as a trigger from diabetic ketoacidosis in a misdiagnosis in the diabetes and from Alexander J. White and Amber Haley from Clinical Diabetes Journal uh, organization. I had taken this study from that. A 30 years old male with the initial diagnosis for type 2 diabetes managed with metformin and strict ketogenic diet, less than 20 grams carbohydrate per day, and experienced as a 60-pound weight loss over 2 months and developed the gastrointestinal symptoms and he present with the vomiting, acetone breath, and small respiration. His clinical presentations was his parameters, blood glucose was 424 milli per deciliter. So you can see in the nutritional ketosis, the normal all mildly low, but his sugar was quite high. His venous pH level was 6.97, and in the normal ketosis, it should be 7.343 to 7.4. So his pH level was down. Bicarbonate was 6 millimole per liter. His bhydroxybutyrate was greater than 8 millimole per liter. In the normal case, 0.5 to 3 millimole per liter. Onion gap was 30.7 millimole per liter. And in the normal, you can see 10 to 20 millimole per liter. His C peptide was 0.42, very less amount of the C peptide. And in the normal, the patient's C peptide, and the ketosis, the C peptide is nearer to normal. And the ketones was strongly positive, mild to moderate in the ketosis, nutritional ketosis. Respiration was small breathing, and symptoms was vomiting and fruity breath. And in the nutritional ketosis, you can see the difference that respiration is also normal, and the symptoms are mild fatigue and clarity. So these all symptoms was there. And diagnosed was the diabetic ketoacidosis due to undiagnosed LADA triggers with insulin deficiency and strict carbohydrate restriction. So management, how to manage, because it was in completely decay. Management was how to management. So ICU admission, and I start the IV fluids and insulin therapy, electrolyte correction, especially potassium, and transition to sub sub continuous insulin and long-term insulin management for the autoimmune diabetes. So it was detected as a LADA, but nutritional ketosis. There's a nutritional ketosis with the ketoacidosis. So nutritional ketosis, you can see, caused by the low carb diet, less than 20 to 50 grams per day, and mild ketones level 0.5 to 3 millimole per liter, and normal pH and electrolytes, and safe with the possible benefit like mental clarity and the weight loss. And in the decay caused by insulin deficiency, almost the type 1 diabetes as well as LADA, and high ketones level greater than 8 to 10 millimole per liter, severe acidosis, low pH level, low bicarbonate, high anion gap, and medical emergency required insulin, fluids, and ICU care. And the second clinical study, and this is the core concept. What is the diabetes ketoacidosis? There is a no insulin and glucose can't enter the cell. Body thinks it's starving, and excess fat burning, massive ketone production, and blood becomes the acidic. And what are the symptoms? That high glucose, dehydration, acidosis, and electrolyte loss. Now this patient is Mr. Rohan Khanna, is a 24 years young guy, and his occupation is an college student, and he is a type 1 diabetic mellitus before 5 years, and his medication is only insulin. But he was very irregular to take the insulin. And the present patients complained with the nausea and vomiting for 2 days, abdominal pain, rapid and deep breathing, increase the thirst and urination, and reduce the oral risk. So history, he was missed the insulin doses, he was skipped the insulin, and recent febrile illness, he was feverish, no alcohol or no drug abuse. So at the time of examination, he was dehydrated, drowsy, his BP was 160 mg per mmHg. His heart rate was 110 per minute. Her respiratory rate was 28 per minute. He has Kussmaul breathing, fruity breath order. He was confused and no focal deficit. For the laboratory investigation, his blood glucose was 410 milli per deciliter. His pH level was 7.1. His bicarbonate was 9 equator per liter. Serum ketones were positive. His sodium was lower side 132 milli equator per liter. Potassium was 5.4 uh, equator per liter. And in gap was 24. Urine ketones was present as well as urine glucose was present. The diagnosis is completely diabetes ketoacidosis. So how to manage? The management was then start by the IV fluid 0.9% NS, IV insulin 0.1 unit per kg per hour. Monitor the electrolytes, especially the potassium. Correct the acidosis and frequent monitoring blood glucose and ketones. So glucose reduced after the clinical course, and what are the outcomes? The glucose reduced to less than 200 mg per deciliter in 24 hours. Acidosis resolved, ketones clear, tran transition on subcutaneous insulin, educated on the insulin use and seek their rules, and discharged after 3 days in the stable condition. So this is the case of the ketoacidosis. His mistake was he was not taking proper insulin, and due to that mistakes he was goes into ketoacidosis. So at the time the diabetes education is most important. We educate him regarding the insulin, how to take insulin, not skip the insulin, how to manage the sick day, and he was completely cured. So what are the rare signs for the decay? So symptoms of the decay and the warnings are fruity breath, acetone odor, vomiting and abdominal pain, acidosis and the dehydration, deep breathing, compensating for acidosis, confusion, sometimes unconsciousness, and severe acidosis and electrolyte loss. So ketosis is a physiological, it's also safe, but decay is pathological deadly. So decay is very, you must very careful in the decay position and immediately give the treatment to the patients. Immediately you have to admit him and look at the content, labs and the symptoms, and history taking is the most important. When patient comes to you, the taking the history is the most important. So the summary is that although the ketosis and the ketoacidosis both causes ketones level to rise in the body, however, they are not same. The main difference is nutritional ketosis is the aim of the ketogenic diet, and scientists believe it can be safe in the short term, whereas the ketoacidosis is the very dangerous. But ketosis also is not keto diet is not sustainable diet, so is not advisable for the long time. People most at the risk of the ketoacidosis include those with type 1 diabetes, but it also occur in the people who have gone without food for prolonged period. Nowadays, diabetes type 5 is also detected, and they refer that due to the malnutrition, it happens. So the people with the diabetes should avoid the ketogenic diet and follow their doctor's treatment recommendations to prevent the ketoacidosis. Thank you.
Thank you so much, ma'am, for this major deliberation. I'm sure audience got to know so many things in this discussion. Ma'am, I can see a few questions from our participants. With all your permission, can I put them across?
Yes.
Okay. Can prolonged carbohydrate restriction for or fasting trigger ketoacidosis in non-diabetic?
Pardon, repeat, please.
Yeah. Can prolonged carbohydrate restriction or fasting trigger ketoacidosis in non-diabetics?
Ketoacidosis in non-diabetic is not possible because they will develop the ketosis. Because what happens when they are not having any carbohydrates? What happens? The body will use the fat, deposit fat for the energy. At that time, the more fat will break down and it will occur the ketosis. But for the normal patient, it is no chances of the ketoacidosis.
Okay. Moving to the next question, what parameters should be routinely monitored in patients on a ketogenic diet, both at home and at the clinic?
Yeah, most of the ketogenic diet, they are most dehydration is the main common problem. So at that time, they must be hydrated. They should have the more fluid as well as little bit of the more sodium. So we recommended them that you take more sodium water with the salt because it will otherwise electrolyte imbalance occurs, sometimes muscle cramps. So these they have watching their hydration. Second thing, sometimes they maybe develop ketosis due to long time of the keto diet. So at that time they must aware of the symptoms of the keto diet, keto flu that I earlier mentioned in my slide. So at that time, they must watch their hydration level as well as keep breathe. Suppose they breathe and fruity odor come, so they may be developed the ketosis acetone. So they must go to the doctors. And third one is that they must be careful regarding the fat intake. They should use a very healthy fats rather than high saturated fat because it will maybe develop the cardiovascular disease as well as they increase the LDL cholesterol.
Okay. Third question is, what role do urine dipsticks and blood ketone meters play in ensuring dietary safety?
I can't understand what.
What role do urine dipsticks and blood ketone meters play in ensuring dietary safety?
But nowadays they are earlier it was using, but nowadays for the ketoacidosis, there are some strips are available for the ketone measuring. But nowadays in the laboratory, test is very useful for the patient. They can know that ketones are developed or no. And for the type 1 diabetic patient, there are always the symptoms of the ketoacidosis and acetone like abdominal pain and thirst, excess and dehydration, vomiting, nausea. So these all are symptoms are present in diabetic ketoacidosis. But still, they can check this through strips, the acetone as well as in the laboratory now it is done in the 1 hour test. Take only halfly 1 hour for check the acetone level.
Thank you so much, ma'am, for your expert opinion that you have shared. And I'd also like to thank all the participants for your continuous participation at our platform. Thank you once again, ma'am, for your valuable
Thank
time and for being with us at our platform and sharing such valuable insights with us. With all your permission, can we end the live here? Hello, ma'am.
Yes,
With all your permission, can we end the live here now?
yes.
Okay, ma'am. Thank you so
Okay.
much, ma'am.
Yeah.
Thank you.